And hello. Good morning, good evening, good afternoon, depending on where you are in the world. And welcome along to this week's Maternity Natural Health webinar with IMCO, the International Integrative Maternity Healthcare Organization. And welcoming this week to Nancy Gerard. Nancy, say hello.
Hi, everyone.
Very pleased to have you here. And we've got some really interesting stuff to be talking about today, that's for sure. And talking about these partograms and how that, impacts decision making. And I'm just going to, now for those of you who may not have seen the poster before you are watching this webinar today, I just want to give you a little bit of introduction about Nancy. The format of today is that I'm just going to be introducing her and then handing over to Nancy, and she will be doing a PowerPoint presentation with you all. And then obviously there's time for question at the end if there are any questions. So Nancy Gehrig is a clinical midwife in Papua New Guinea, and she has a comprehensive maternity midwifery experience. And obviously she has her bachelor in midwifery to be a midwife, but also has been doing her master's in midwifery. And that study that the research that she's been doing with that is what she will be introducing to us today. And we're very honored that this is the very first time this brand new information is going to be presented. So that's just very awesome. And Nancy's passion is to improve rural obstetric and reproductive services. So what we're really talking about today in this topic is the perception from midwives on the use of the Partograph for transferring labouring women from rural health facilities. And so very much welcome, Nancy.
Thank you.
And let me just bring up your PowerPoint. And now, of course, just a reminder to our participants as well, if you want to put your name up in the chat area and let us know where you are in the world and your role in the world, that would be great. It's always interesting for us to know. And also don't forget that there is the Q&A button on your screen, and so if you do have any questions, just put them in there. We'll absolutely make sure that they're covered off before the end of this session. And so, right, I'm just going to go into sharing the screen. So I'm going to be clicking the slides forward on behalf of Nancy. Okay, so you should all be able to see that now. Fantastic. All right, so I'm going to hand over to you, Nancy.
Thanks, Katie, and hi, everyone, wherever you are in the world connecting to our webinar this morning. My name is Nancy Gehrig, as Kate has introduced me. I'm a midwife, and it's an honor to do my presentation. That's my first presentation after I undertook this research. And thank you once again for the opportunity to bring to light the use of the maternal care in PNG, especially in the rural health facilities. So my presentation this morning is about the perception of midwives on the use of Partograph for transferred laboring women from the rural health facilities in PNG. Next slide. So basically the presentation outline entails introduction, a little bit of understanding what Partograph is, and background on the maternal health services in PNG, the aim of the study that I undertook, the settings, and the participants who helped me give their views on what they perceive about the Partograph, the findings from the study, a brief discussion, and then we should have a conclusion and followed by recommendation. And if you have any questions for the presentation, you can be able to ask after the presentation. Next slide. Maternal mortality is a global concern, and it remains unacceptably high, especially in the low to middle income countries. And most deaths are related to pregnancy and childbirth complications, which are mostly occurring in the rural, remote areas, both in developed and underdeveloped countries. But this morning's presentation is basically looking at Papua New Guinea, where most maternal deaths occurred in the rural areas, so which can be secondary to severe bleeding during pregnancy, birthing, and other complications such as high blood pressure, hypertension during pregnancy, infections, and also unsafe abortions are possible causes of maternal deaths. In Southeast Asian region, including Papua New Guinea, it is reported that high maternal deaths occurred in the rural remote areas. And since 2015, it was reported that the maternal mortality rate of Papua New Guinea accounted around 595 deaths per 100,000 live births. So that's basically giving an highlight that there is need to improve the maternity services to reduce the high rate of maternal mortality in many other low to middle income countries, including Papua New Guinea. So this morning's presentation will look at one aspect of the obstetric care that is very important, which contributes to reducing maternal fetal complications. Next slide. So what is a partograph? That's basically the pictorial appearance of the partograph, but partograph is basically the pictorial representation of maternal fetal, or the mother and the baby, the fetus in the mother's uterus. During labor, midwives and obstetricians, nurses, maybe community health workers use to write down all the particulars or observations taken during labor to help the caregivers assess the progress of labor, and also helps them to detect deviations in the observation, and that basically help them to make decisions whether to take an action immediately or to the referral or to attend to the mother and the baby. So partograph is basically the pictorial component of the obstetric care that entails all the maternal fetal well-being when a mother is in labor. So a bit of a background about Papua New Guinea. I know in the world map, you'll see Papua New Guinea is one of the island countries in the Pacific region. And where I am now, it's where the red mark is. I'm serving in one of the regional hospital, and the small picture down below, you can see that's the bit of a geography of where I am. It's a bit mountainous. So the total population of PNG is basically around 9,318,000 for 9,318,049 as of 26th August 2020. Bulk of this population, they live in the remote and remote rural areas of Papua New Guinea. And accessibility to timely health care and appropriate care for the mother and other general population is always hampered by poor road condition, no transportation at times. Most people have low socio-economical status, and especially in the rural remote areas, so remote health facilities, there's always a shortage of skilled birth attendants. And that also boils down to poor governance and leadership, that the distribution of resources and all these are not fairly enriched to remote rural areas. So that's why there are and these are the factors that prevents mothers especially to access timely and appropriate maternal health services. And that's further leads to, contributes to obstetric complications, particularly in rural health facilities where there's one or two midwives working there, or sometimes no midwives, but it's just the RNs and the community health workers attending to laboring women. And when they encounter complications, maybe there's no transport available, they don't have skills to attend to the emergencies, and most mothers, unfortunately, they suffer the complication and even leads to death, and that has contributed to the high maternal morbidity and mortality, and also the perinatal, especially the babies as well, who died during the first hours or first 24 hours of their lives. Next. Yep. Okay. The aims and objectives of the study that I undertook was to understand the perception of midwives on the use of Partograph when referring laboring women from the rural health facilities to the main hospitals. As I've highlighted the constraints in efficacy of health service delivery in the rural health facilities, there are, many factors to consider, but the one that is very paramount is the health worker working to attend, during attending to laboring women and understanding the mother's condition, whether to have a safe delivery at the health facility or whether to do transfer. The Partograph is very important. That's why the study aims to understand the perception of the midwives, both in the rural and the main hospitals, on how best Partograph was used when referrals are anticipated. So the objective of the study was to evaluate the effective use of the Partograph by midwives or nurses in the rural health facilities, and also to ensure that Partograph should be included as an integral document, referral document during obstetric emergencies at all levels of health facilities in PNG, like from primary level to secondary to tertiary health facilities. So the settings and the participants of the study was basically in PNG, and the midwives were working all around PNG. It was random selection, and those who have volunteered to participate were 10 midwives who have practiced in both, in all levels of healthcare, like from primary health to secondary to tertiary. So the perceptions of the participants collated were like a collective view on how they perceive about the use of Partograph at their level of health facility that they practiced. Next slide. So from the findings, there were main themes. There were three main themes that stood out: was the use of Partograph, referrals without Partograph, and training on the Partograph. So with the use of the Partograph, almost all the midwives that were interviewed expressed that the Partograph is an important obstetric tool that all obstetric caregivers, like those who attend to laboring women, whether a nurse or obstetric doctor, RN or community health worker, as long as they attend to a laboring women, Partograph should be an essential tool to use to monitor the progress of labor. And also for another main theme that was identified in this study was the referrals without Partograph, which was the main aim of the study, was to really understand whether the Partograph was included in the referral document or was it used appropriately. So with the referrals, it is identified that most times Partograph are not available, especially in the primary and secondary health facilities, especially in the rural health facilities. As Partograph is not often available, and the staff who are working to attend to laboring women are not aware of the documentation, or even not attaching the Partograph when they do referrals. And interestingly, in the study, I've discovered that some Partographs are concealed because at the rural health facilities, the practicing nurse or midwife, whoever that refer the mother, when they see that the maternal fetal well-being is gonna be compromised, or if it's going to lead to a poor outcome, sometimes they tend to throw they don't attach the Partograph because they don't want the receiving end of the referral to know that what they've practiced is not, according to the protocol. So that was one of the findings that revealed from the study. And as I've said, Partograph, not attaching Partograph with the referral document was discovered that there were many factors contributing. Is like they don't have printers to reprint the Partograph, so Partograph is not always available, or the staff referring the mother is not skilled enough to jot down all the important details of the mother and the baby, and maybe they're not aware that Partograph should be included. So that was the one of the findings that revealed that why Partograph was not attached during referrals. And the third theme that was identified during the interview was the training on the Partograph. Most midwives interviewed, they expressed that they need refresher training on the use of Partograph. Since they were trained during the midwifery courses, Partograph was briefly highlighted or included in as part of their courses, but not in more detail. So they need refresher training to refresh their skills and knowledge on the use of Partograph. And also had a team that, example, like the RNs and community health worker, especially in the rural health facilities, they need training on the Partograph because they need to be aware and they need to use the Partograph effectively so that they can detect complications early and do prompt referrals to save the mother and the baby. So there was need for trainings on Partograph, whether refresher or fresh training for obstetric caregivers, or those who are looking after laboring women in the rural health facilities, particularly need more training on the Partograph, on the use of Partograph. So just brief discussion on the findings. Partograph is basically an important obstetric tool which guides midwives, obstetric caregivers, and other health team that look after laboring women, which help them to monitor the progress of labor and help them to detect deviations from the normal findings so they can anticipate the prompt and appropriate care immediately. And that comes with referring women, especially from the rural facilities, to the main hospital. So Partograph is identified to be an integral or important obstetric tool for health workers who are caring for laboring women. And also it is discovered that Partograph influences the diagnosis of complications and enable caregivers to undertake decisions in a prompt manner so that they can refer the mother and the baby immediately to the nearest health facilities to prevent complications and save the mother and the baby. So Partograph is very important in influencing decision-making and also undertaking appropriate care to save the mother and the baby. The study also revealed that the midwives appreciated the importance of Partograph in their practices, as I've emphasized that Partograph, without Partograph, a midwife or obstetrician or anyone caring for laboring, the health worker caring for laboring women, the practice would not be effective if Partograph is not used. So in obstetric, there's complications is inevitable. You may not anticipate, but it happens anytime during the care. So with the use of the Partograph, the midwives appreciated that it has helped them and guided their practice to identify complications, and they refer the mothers to the next health facilities where possible. So having said that, Partograph is very essential, like it prevents further maternal-fetal complications during labor, birthing, and also after birthing, when mother have a good, safe, and successful birthing, the mother and the baby are good after the birthing. So Partograph plays an important role during the intrapartum period or during the labor period of the mother. Inconsistent and inappropriate use of the Partograph was one of the constraints identified which contribute to poor maternal fetal outcomes, especially in the rural health facilities in PNG. Having said that, like in the rural health facilities, we don't have most basic obstetric kits or medical supplies. And when we encounter complications, it's really challenging to ensure that the mother and the baby is safe. So when Partograph is not used, and with the inadequate supplies or unavailability of appropriate medical supplies to stabilize mother and the baby's condition, that's further complicated the mother and the maternal fetal condition, and which further leads to morbidity and mortality. So from this study, it's identified that the inconsistent and inappropriate use of the Partograph was one of the factors that contribute to poor maternal fetal outcomes, especially in the rural health facilities. So in conclusion, the study has shown that there's a high rate of perinatal and maternal morbidity and mortality in the rural areas in PNG, which can be partly prevented if Partograph was used effectively at all levels of health facilities. And that may be the same stories for other underdeveloped countries around the world. Its usefulness in early detection of maternal fetal complications is very important to enable caregivers in their decision making, and to also take prompt actions, especially in referring the mothers, laboring mothers, to the next or nearest health facilities for further management to prevent maternal fetal complications and save the mother and the baby. So the constraints identified, as I've mentioned earlier, there's unavailability of Partograph in the rural facilities is one of the common problem. Lack of knowledge and skills in using it. The midwives have expressed that other staff that they work with don't have that adequate knowledge and skills on the use of Partograph. So when they're on duty and looking after the laboring women, they don't mostly fill the Partograph correctly, and that also affect the diagnosis of complications. So they don't identify the deviations easily or quickly, and the delays also leads to maternal fetal distress and other related obstetric complications that affect the mother and the baby's well-being. So that's why regular training on the use of Partograph was identified to be the main need in most level of health facilities in PNG, especially in the rural health facilities, to improve obstetric care so that mothers and babies' well-being can be optimized, and prompt and appropriate referrals can be done in a timely manner so that the statistics of having high maternal morbidity can be further prevented and reduced. So the recommendations that are made from the study is to have more trainings and regular refresher courses on obstetric emergency care, including the use of Partograph in most of our rural health facilities, training the staff to be aware and to be skillful in using the Partograph so that there's appropriate care can be given to the mother and prompt decisions can be undertaken if need be. So training is one of the recommendations that is derived from the study. The second recommendation is to have Partograph available in rural health facilities as much as possible so that when laboring mothers come into the facility for delivery, Partograph should be used at all times so that deviations can be detected and referrals can be made promptly. So availability of Partograph in rural health facilities is one of the recommendations that's highly recommended. And finally, Partograph should be one of the compulsory documents attached for every referrals for laboring women at all levels of healthcare facilities in PNG. So that is important because with the Partograph, it will give overview of the maternal fetal condition at the rural health facilities. And when the recipient when they see the Partograph, they already know what the maternal fetal condition was and is now, and they can from there take on the maintain the continuity of care appropriately to save the mother and the baby. So these were the three main recommendations derived from after the findings from the study. So that's all for my presentation. It's brief of everything, but I hope the main message of the presentation this morning is about the effective use of Partograph and its importance in saving the lives of mothers and babies, especially in the rural health facilities in PNG and maybe other parts of the world, but particularly in PNG where we have challenges in ensuring that effective maternal health obstetric care are given at all levels of health facilities, where Partograph is an integral document or tool that needs to be used by all caregivers when caring for laboring women and anticipating present referrals. So that's my presentation this morning. And thank you all for your ears and for your time. If you have any questions, I'm happy to take on the questions now. Thank you.
Thank you so much, Nancy, and a big congratulations to you, for doing your masters and focusing on this, really almost it gets a little forgotten about in the conversations. And I can't think of the last time I saw some, very current research on partograms. So because I've just been around for so long. And so that's just awesome. Thank you so very, very much. The thing with the partogram, of course, sorry, my eyes watering for some bizarre reason. But the thing with the partogram, of course, is it's just such a wonderful way to have that instant view, that instant summary on what's been going on over the course of the previous hours, because when you've got the handwritten clinical notes going on of things that are happening, it can be tricky to go back and read through and sort of try and pick up that, that bigger overview picture, isn't it, of what's going on. But the partogram is such an instant view of seeing, the progress of dilatation and the progress of labor contractions, and particularly that baseline of that fetal heart rate, and has it been slowly creeping up over the last few hours, because of what of course we all know as midwives is that there are times in care where things are very, very obviously an emergency, and there are very obvious things of management that should go on. But so much of our time is spent in those areas of grey where things aren't necessarily at all abnormal or an obstetric emergency, but it's kind of this trend, and so you're just watching it going, whoa, and we do work in areas of grey a lot of the time, and so that partogram just really can help you get that instant overview. And as you say, for the receiving staff at the other end, it gives them that instant view rather than trying to pour over pages and pages of clinical notes to get an idea of what's been going on. I'm interested to know what were the sort of surprising percentages, I guess, roughly that you were dealing with, what was, say, the percentages of rural and remote rural labours that were using a partogram versus not, or the amount of women that arrived in with a good partogram or arrived in with a half documented partogram or arrived in with no partogram. What was those sort of splits?
Thanks, Kate. Roughly, I would say it would be less than 50% of Partograph being like roughly documented, not attached, or just the script of it. So it's like between 30 to 40%. So that's where I identified that Partograph was a need to take on a study and emphasize the need to have Partograph as part of the referral document. So
wow,
that's why
probably maybe about a third would come in with a
about a third.
photograph. Wow. Yeah, that is pretty low, isn't it? Fascinating. And did you find that the those rural and remote rural midwives had kind of an attitude that they wanted to you know, like they welcomed more training and wanting to do that and sort of cover that base off, or did you kind of had some resistance where they might have felt like their judgments getting questioned and that's why they've concealed the Partograph? You know, what was their, I guess, receptivity to, you know, completing a Partograph for every woman?
Yeah, it's really challenging when you are judgmental to your colleague in terms of their practice. But to be frank, the midwives tend to think that they have experience in using it, but in instances where there's no Partograph or they're rushing the referral, so an unskilled birth attendant have referred the mother, that's when the challenge of not filling it appropriately or not being attached or not being done. So when questioning the midwives, they feel a bit intimidated that, maybe
Yeah.
our practice is questionable. So that's why we have to undertake a study. So with the evidence that we find, that would be concrete enough to provide facts and evidence to justify that maybe our practice is correct, but we may need to improve more better for the good of our mothers and babies. Yes.
Yeah, I can see that. You know, I think we can all feel that situation where they almost may feel scared or, as you say, intimidated that the Partograph could almost be a documentation of their poor care. So the fact that it's getting concealed is awful, that there's that kind of fear, I guess, on their part, right?
Yeah, their fear on their part that they thought that, or they're not practicing well and they're not practicing according to the standards. So that's why Partograph is concealed at times.
What sort of percentage would you say was concealed? Is it kind of common or quite rare?
Quite rare.
Right, okay.
Quite rare.
Good, I guess. Yeah. And what sort of amount do you think are not using the Partograph just because they're just not skilled enough in it? So they're not confident to be documenting on it. Do you think that's a big chunk?
That would be around 60%.
Wow, yeah, so quite high.
Quite high. Yep.
Yeah. Is there a problem with just literally accessing the piece of paper? You know, I know that for myself, I'm semi-retired now, but when I was a case-loading self-employed midwife, I had like a self-carboning book that was used for each woman. So each woman, I had their own book, and which contained their antenatal and their postnatal, all their clinical notes, everything was in there. But also, you know, one of the pages contained in that book was the Partograph, or the Partograph. So that, you know, it was in there. It was easy for me to have access to it. Do you think that's part of the problem, that they literally don't even have the piece of paper?
I think yes, and especially in the rural areas, you know, there's not always accessibility to power where they left printers to reprint the Partograph or do photocopies. Right. That's the main constraint where Partograph is not available. But if
they just can't go into the office and photograph, you know, 20 copies of it, so they've got it sitting there. They haven't even got the piece of paper.
That's right. When they bring referrals to the main hospital, they always ask the hospital team to provide quite a good number of Partographs so they can take it back to the facility and use. So this is what it's been done. But to have them readily available at their rural health facilities, it's a challenge.
Right. Yeah, and it's almost, is it common practice in PNG where those rural and remote rural midwives are supplied with a birth kit for each woman? you know, so do they sort of pick up birth kits from their local hospital that they've got in stock for delivery?
Depending, I should say, depends on the type of health facility and the location. If it's very, very remote, and if it's like a primary health facility or secondary, they not mostly have the set bedding kit, but they would have the basic instruments for delivery and the medications that are given to mothers during labor or after birth. So
they don't have, say, like an individual kit per woman?
no,
No.
not
Okay,
individual for a women, but a
right.
general one that they re-sterilized after use
Yes.
and repack it for next use when mothers come. So it's not, there's no per bedding kit per women, but for general use for every woman, and it's reusable after being sterilized.
Right. Okay. Yeah. Oh, so fascinating. And we're very humbled that this presentation today was the very first time that you were presenting
It is.
and
Yep.
you did a great job. And I know it's always very
Thank you,
nerve-wracking.
Katie.
You know, I mean, putting together it's such a big thing, you know, doing your masters, and so well done you for, you know, presenting that to us today. And I understand that you're going to be presenting this latest research at an upcoming maternity PNG conference.
Yes.
So that's great. And then obviously, you know, so much of that information will be transferable, you know, to you know, all countries really, where there's remote and rural, you know, rural and remote rural situations. I know that for myself, in my practice, you know, a good 40 to 50% of my women would be labouring in either a home birth or a local primary care birth centre in a rural setting. And you know, that and if we have women who are medically complicated in any way, then they are automatically at the hospital. But you know, for those healthy normal women just going into natural spontaneous labor, it was very, very normal to be in home birth or primary care birth center. And it's always, you know, it's a big deal to transfer a woman, and not and obviously, you know, we want to do it in the absolute appropriate and timely manner, and that's where that overview of that Partograph just so often, you know, just shows you very clearly what's going on. You can see a trend, you know, a trend of a slowing of progress, or a trend of, you know, an increasing baseline on that fetal heart rate, or whatever the trend is. But you know, there is always that kind of like kind of feeling of you put the woman first, but you do wonder about the judgment that may come down onto you as a midwife for when you have done that transfer. You know, because it's not a minor thing. We know, you know, as soon as you take that, as soon as you're saying to that woman, we need to transfer you in, you know, she gets this huge hit of adrenaline and fear and anxiety, and so do everybody else in the room with her, all her birth support people, you know, the partner or the mother and the mother-in-law, whatever. Everybody goes into this place of fear, and it's you know, we do our best to, you know, reassure them as much as you can, but it's you know, it's a big thing for the woman as well. So it's that, isn't it? It's
right.
just such a big weighing up, you know. And at the end of the day, you know, it is best practice to, you know, work as the conservative side of it, you know, if at all unsure, do a transfer. But but that partogram is so incredibly valuable.
True.
making that decision. So good on you for focusing on something that's a very, very old document, isn't it? It's been around for a long time.
It is.
Yeah. Is there anything else that you would like to add in as part of your, before we wind things up, to conclude with? And also maybe just let the audience know your contact details perhaps as well, in case they have any questions that they would like, or communication they'd like to do with you on the topic.
Yep, I'd love to leave my contact if they want to contact me. That's good. Otherwise, thank you for attendees this morning, including my husband. I'm really happy that he's listening there. And thank you, Katie, for the time given and the opportunity to do this presentation, the first after the study. And I really appreciate the time and the opportunity, and looking forward to next opportunity if given to do another presentation for this webinar. Thank you, Katie.
Fantastic. And the email for Nancy Gehrig is NAN, so NAN for Nancy, NAN, and then Nancy's last name Gehrig, which is GEREGL. The L is silent, and the number 4 at gmail.com. So that's NANGEREGL 4 at gmail.com. So thank you so very, very much for sharing your research with us today, and thank you for making us the very first people that you're sharing it with. And we want to wish you all the best with passing on that wisdom to other organizations along the way. And it's always about improving outcomes at the end of the day for our mums and our babes. So thank you very much, Nancy, and thank you everybody that's here today as well, and those who will be watching the webinar later on. We wish everybody a lovely rest of their day.
Thank you,
Nancy. Bye, everybody.
Bye.